Hey there, did you know that both men and women can benefit from pelvic floor physical therapy for a variety of reasons? We can better learn to advocate for ourselves, connect with our body, and how to communicate effectively with our healthcare providers, and release any and all shame when we are talking about anything down there. Today, you're going to meet a doctor of physical therapy, Stacy Gresham. Hey there, how are you doing advocating for yourself? And what about how connected are you with your body? Enough to communicate with a healthcare provider. Are you stuck in shame if you have to talk about your pelvic floor? Well, in today's episode, we're going to teach you how to have conversations to not only release the tension in your physical body, to strengthen the weak muscles, but to also move forward. Stay tuned. Welcome to Hill Talks Midlife Podcast for your body, mind, spirit, and business. As an occupational therapist turned entrepreneur, I have done a lot of learning, and my hope is to share these incredible people that I've met along the way with you so that we can laugh, learn, and grow together. I am your host, Hillary Baggett of Community Bloom and the Women's Midlife Network, and I'm truly glad you're here. Named Stacy Gresham, and she's a physical therapist, and she's not just any physical therapist. She was one of my team of physical therapists, and today we're talking pelvic floor, and she's going to answer all these questions of what is your pelvic floor and how to know if somebody actually needs pelvic floor physical therapy and what questions to ask. Stacy also has a specialty in visceral manipulation, which is helping what's happening in your abdominal cavity, basically, and she worked with me on that as well. She is a graduate. She's been practicing for over 12 years already, and she just opened her own practice, so that's really exciting. So she just branched off to provide her own in-home physical therapy services with gut health and visceral manipulation specialties, also scar mobilization and prenatal and postpartum care. I mean, wow. So Stacy's a gift. Welcome, Stacy Gresham.
Lori, thanks so much for having me on. I really appreciate it.
Oh, it's great to see you. And we're both on the introverted side of the spectrum. And people don't believe me when I say I'm an introvert, but I'm like, I need that time to back off and recharge. And I love that it's just you and I chatting today. First, with physical therapy, in case there's someone listening and they want to know, well, what does a physical therapist do in general?
Yeah, it's a really broad question because there's so many different specialties. I'm sure you understand with occupational therapy. It's a big question, and it's hard sometimes to tailor it and to make sure that people understand what all it encompasses, what we can do for other people. And so essentially, I break it down as physical therapists help people move better. We're experts in movement. And so that can look like a lot of different things. It can look like helping babies developmentally learn how to move. It can help adults learn how to stand better or have better posture when they're doing repeated exercises. It can help older individuals with balance and with optimizing their mobility so they can stay independent for longer. And of course, with some of my specialties, things that we don't always talk about is mobility through the abdomen, through our viscera, you were talking about in the abdominal cavity, and optimizing function of pelvic floor. And so it's one of those areas that people don't talk about. It's sort of taboo to be able to share.
That's right.
There is movement and function that happens in this area too. And it's essentially a lot of muscles helping to hold and support, which is why physical therapists can work in this area and help people improve sexual function, improve mobility if they are having trouble with walking. Some people don't understand it could be part of that dysfunction in their pelvis. And so it's really important to have a specialist really take a closer look with them.
Yeah, it is hard to define what we do as therapists. And I'm an occupational therapist, you're a physical therapist, And the specialty of pelvic floor physical therapy is kind of our primary focus today with the visceral manipulation. And in case somebody doesn't know, your viscera are how your organs move, well, what your organs are. Your liver, your spleen, your pancreas, your colon, the small and large intestine, and how those all work together with your pelvic floor. And I want to yield to the expert on this. And Stacy has a different perspective. I think by the time I saw you for physical therapy, you were my third team member for it. And you said, hey, I practice a little bit differently. And every therapist has a little bit of a different kind of style and personality, just like we're all unique. And I appreciated your forthrightness. I said, well, good. Just so you know, I'm not expecting you to be like someone else because I'm coming to you for you and what you have to offer. So it was really a gift to get to meet you for sure.
Yeah. And I enjoy patients who are very open to sort of different forms. And it's just amazing to me because I think, like you said, I've heard it lots of times where people have tried different things out there. And for some people, orthopedic physical therapy works wonderful. And for others, it might be missing a link. And so they have to continue to search to find that practitioner that really fits for them, that hears their needs, that sort of makes a change that they can perceive and take forward into the world. And I think that's a really hard thing in today's medical world to sort of make that match between patient and practitioner and to continue to search after that answer if you haven't found it on the first round.
Absolutely. It takes a while to find the right fit for what you and your body need and the personality and the experience of the professionals. I'd like to make sure that we define what is the pelvic floor, because I think some people are like, is that just a Kegel, right?
Right. Yeah. And I'll admit I fit into that category, and it was sort of awkward in learning, again, that taboo piece that we don't talk about it. I think in physical therapy during my education, it was a very small portion of that educational learning because it really did require this specialty education after the fact. And so understanding, again, that it is a group of muscles and they come in multiple layers. And so it's really important because one person's dysfunction in the pelvic floor can look very different from someone else's. And so understanding this idea of superficial layers of muscles that really help us to hold continence. So, are we able to remain continent in bowel and bladder? You can hear some people have dysfunction with this during pregnancy, postpartum. Others don't have it till later in life. Some never experience it at all. So understanding that might be someone's dysfunction with a superficial layer. It looks like a triangle, essentially, around those openings within the pelvic floor. And so some people have dysfunction on that very superficial layer. Others, there's this essential deep layer that provides like a sling or a hammock. You'll hear it described to help support and hold up the pelvic organs. So bladder, uterus, obviously males have pelvic floor as well. So they're holding up different organs. So it's very important to understand where the dysfunction is and what layer that you may be having trouble with these muscles and how to get that assessed. I think most people don't know that they even exist in that area and how to strengthen them. You mentioned Kegel before. There's quite a bit of evidence that even after instruction, patients don't understand how to contract the pelvic floor. And I was one of these people. I went to my training course. I know, let's all raise our hands.
Me too.
I had so much difficulty isolating and not using compensatory muscles. And so I think it's really important. I know a lot of people are hesitant at first to hear the word internal examination. Oh my gosh, this is a violation. I couldn't possibly, have this done. But then that awareness that comes when someone's able to feel what's happening within those muscles to help you understand and give you biofeedback in that moment to say, oh, you've almost got it, but we're using a little too much glutes or a little, you're squeezing your thighs together using your adductors. And that's not exactly what we want. Let's try to hone in and really specialize this contraction and make sure it's happening in the right place.
Yeah. Absolutely. And even as a health professional and as a therapist, I went in and I was so nervous the first time and I thought, you need to do what? And it was one of those hard things. And I know that you were part of the team that gave me this language of purity culture and growing up of thinking, oh, it's not okay for someone to look there or touch there or even for me to do that. And kind of breaking down all those barriers of this is a part of my body. And if there's dysfunction and there's a way to get to function, then all of this is okay. And there's no need for shame or embarrassment or disgust or any of that, even though we can certainly be conditioned or grown up, to believe that. So I appreciate you being able to talk about it. And it was very humbling for me to go through pelvic floor therapy on so many ways because I thought I was really in touch with my body on a very deep level. And I was, except for that exact area. And I had gone through traumatic childbirth with one of my children, and I had never gotten therapy to resolve those issues. So my body had compensated over the years, and going downstairs or walking down a mountain, we hike a lot here in Colorado, and it was just difficult. And then we realized, oh, I've got weakness and these other factors. So what can we do? And not everyone who has pelvic floor dysfunction needs surgery. So that's really important that you should always, and especially if you have a surgery scheduled, make sure you find a pelvic floor specialist first and go for 4 to 6 sessions before your surgery so you can resolve some of those existing conditions. And then after surgery, you can go back to finish that. I don't know. Is there anything I missed on that?
No, but it's not an uncommon story where patients who are very body aware and they understand how things feel when they move their arms and legs and, like you said, hiking, very active, but for some reason there's a disconnect in that area. And so really working on this neuromuscular control, reconnecting the nervous system to the muscles in that area and helping people become aware. How do I access this area? How do I engage when I need to? Like heavy lifting, people don't know that that's an important piece of your core and you really need that to be flowing well. I think sometimes we've normalized and, joked about, oh, I leak a little when I, do powerlifting, CrossFit, or when I'm running or jumping or those type of things. And it's hard sometimes to break down those preconceived notions that that's normal. It's common, but it's not normal. And so we really have to work in giving ourselves permission to sort of investigate that area, what's going on, how, like you said, how can I optimize and really make it functional again? And there's someone out there to help you with it. Sometimes people get blocked because they don't realize there's help for that area. Or like you said, maybe the only option is surgery and they just don't want to go there. So I think there's a range of ways to address and treat. And I think it's lovely to be able to help people find those answers so that they can come to terms with what do they feel comfortable with. Maybe it is, oh, I just need to learn how to find these muscles. I'm going to try some of these tables on my own. Or I'm really having trouble feeling what I'm supposed to be feeling. Maybe I need to enlist the help of a professional and see what's going on and just get some feedback about what I need to be doing.
Yeah, what really stood out to me when you said of, hey, just because it's common does not mean that it's normal. And I think we have to really get that message out to women of all ages. And just because your girlfriend says, yeah, I leak a little too, or yes, this is hard for me, or it doesn't mean that you're stuck living with that. And there's so many things that you can do to give you then that confidence of, yes, you can go to these places. Yes, you can go hiking. And if it's, I think there was a great list in the bathroom actually at Hope Physical Therapy, right? And I thought, this is life changing. And so it was, hey, if you're going to the bathroom all the time, if you make sure that you know where, you want to make sure you know where a bathroom is every time you enter a building, if you have trouble with leakage, if you have trouble, and whether it's bowel or bladder, both of those issues, because the pelvic floor impacts both of those bodily functions. And, a little note to all of the listeners out there, everyone pees and everyone poops. And it's just a normal bodily function. And thank goodness we do, because if we didn't do that, our bodies would really shut down. So it's a really important aspect to normalize that it's a body function. And if it's not working right, then we want to get to the professionals that are going to help us.
Yeah, it's a real key to health too. I think a lot of people who are seeking after, how can I be the best that I can be? Really understanding that dynamic of, going to the bathroom. And when we understand, oh, wow, I go 16 times a day. Is that normal? Or, we need to figure out, I only go, I go poop once a week. I've had so many people think that was normal. And so really educating around, like you said, some habits that we have, maybe, I just need to make sure I have a bathroom no matter where I go. It's normal for you, but it might not be normal function. And just having someone to let that information out to that sort of understands the dynamics and the physiology can really help you explore, gosh, I thought this was normal my whole life. I had trouble with my stool quality. And ever since I was young, ever since I can remember, I was 10 years old and having chronic diarrhea. And I just thought that was normal. And it took me into my 20s to really have solid formed stool and recognize, I didn't realize how much I was missing before. This is normal. And if you're living in dysfunction, it's really hard to equate that unless you have loved ones in your life who can talk about this, which is not common for some people. And for others, they don't want to share. And so just knowing that it's a safe space, you know what I mean? When we talk about pelvic floor and we talk about talking about bowel and bladder habits, I think that's the barrier that so many people have to get over. It's okay to talk about. It's okay to share, and finding a practitioner who will listen empathetically and really understand and want to help you and get you to the right person that can help you do that.
Oh, yeah. I think that was I felt so nurtured when I came to physical therapy, and it was, okay, this is a safe space. Ask your questions. Let us know how your body's doing. And I had to come in and give a full report. And I thought by the end, I would just come in and say, okay, here's what's happening. Here's what's not happening. Tick, 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 tick. And it just, it's like, that's okay. It was very freeing I can just name it, claim it, and be free, and not just be kind of weighed down by any shame or discomfort in discussing, because the team, everyone I went to, was just there willing to help me and listen. So it was really a gift.
Yeah. And you really hit on one other important piece of that psychological health, how much that manifests in these areas, in the pelvic floor, within bowel and bladder habits. There are so many people that don't talk about the emotional side, the trauma side that can sometimes manifest physically in our bodies. And so I think it's really important to understand sort of where is dysfunction coming from, really trying to get at the root cause and listening to people's histories. It's one of the most important things I think as practitioners we can do is really use our patients as the expert in their own history and really dive deep and understand where they're coming from so we can help them.
If you're looking for information on sexual health or healing from trauma in the pelvic floor, check out episodes 48 through 51 and 53 with Megan Darmstadter. Well, I wanted to ask you, Stacy, how does one really know? Like, what are kind of those top signals that someone knows, male or female, that they need pelvic floor physical therapy? We kind of touched on them, but could you highlight like specifics?
Sure. I think, like you said, we've gone over a few, and some of them are very clear. I'm having issues with leakage, and I need to address any bowel or bladder dysfunction if I can't make it to the bathroom. But you mentioned another one, urgency. You may not have to have leakage. You may just feel like you have to go and you're not going to quite make it, but you always do. And that's still dysfunction. So any kind of issues with being able to retain or hold bowel or bladder within a window that's appropriate. If you should be able to make it to the nearest bathroom, to hold it for 10, 15, 20 minutes, continue to expand in your bladder without having an issue. And so if you're having trouble, the first time you feel like you have to go, you also have to make it to the bathroom. Otherwise, you're not going to hold continence. that's dysfunction. And so that's something that pelvic floor therapy can help with and address and get to the root cause. Is it tight musculature? Is it weak musculature? Is there some sort of scar tissue that doesn't allow things to move appropriately, which so many people that have had surgery in the past don't get that education that could be happening in their body. There's also sexual dysfunction. So difficulty maintaining an erection. For women, it's being able to orgasm. And I don't think people talk about this as, hey, physical therapy can help with that. And so I think a lot of people come in for other issues and then recognize, hey, this might be an area that we can address as well. There's also the issue of prolapse. We haven't gotten into that very much, but those pelvic organs sort of bulging or coming, pressing down, coming out of those openings or even close. You don't even have to have them protrude all the way. They can just not feel supported. This is very common after you've gone through pregnancy, especially if there's any kind of complications. If they're, for a lot of people, they have gain excessive weight, and that's different for each person, but that puts more and more pressure in that sling area that we were talking about, those deep pelvic floor muscles, to be able to hold that weight up, and that gets stretched out over time, and it's hard to reestablish that strength. And it's not talked about a lot. For me, especially, I had babies and nothing was ever discussed of, hey, I want to make sure you're doing your pelvic floor exercises, make sure you do your Kegels starting at 6 to 8 weeks, depending on what your surgical history was. None of that was discussed. It's sort of, we wait for dysfunction to be present and for us to go to the physician and discuss it. So I would love to see that culture change of where this is given in a packet of information of here is what normal rehab should look like after the fact. And if you're having trouble, please reach out, and here's how you find practitioners that can help you with that. I think a lot of us are left to suffer alone until we finally just say, I need help and I've got to.
100%. That is so key. So if there's an urgency issue, if there is kind of a continence issue, if there's any sexual dysfunction or pain or inability for men to get the erection, for women to reach orgasm, scar tissues, organ prolapse. I mean, I had the weak muscles and I had the over tight muscles as well at the different layers like you discussed. Plus I had a prolapsed uterus, and then they had taken everything out and reconstructed. So I had a whole lot going on, and I was so grateful to have a team of therapists to be able to kind of come around me and provide some different solutions, because I needed the internal work and I needed the visceral manipulation work that you had offered to help. Because sometimes if someone is sent into medical menopause, which I was, my awesome doctor had saved an ovary, but that little ovary just couldn't hang on. So by 8 weeks post-surgery, my hormones had crashed, and that impacts the ability of the bowel to function. And when you can't rest and digest, then things just don't work as well. And when we're not normally eliminating, then it just impacts our function in daily life. So it was such a gift to be able to come and to entrust you all with all my issues.
I loved how it worked, really, for so many patients. It really is peeling away those layers. And so you start, just with this access point. I'm having trouble with urgency or frequency, or when I lift or when I jump, we can have that stress incontinence. And so usually it'll just open the door, and we'll investigate that one area. And inevitably, we're so complex and our bodies really work together as this beautiful symphony. But when some things happen, especially, over time, we accumulate all this dysfunction. And then one day it's like, wow, it hit me like a ton of bricks. I just had all of these issues. And just like you said, you mentioned 3 or 4 different causal factors that you can look at and address and really peel away those onion layers of where is this dysfunction coming from, and helping the body find function again.
Absolutely. Well, I think you answered that question really well, of if something, even if it seems normal for you, if it's impacting your function, it's worth checking out a physical therapist. And that brings me kind of to the next question of, how does one find and select the right pelvic floor physical therapist because there's very specialized training. And I've had people ask me over the years, they're like, hey, do you do this? I said, I am not trained in it. I'm not even going there. Now that I've had the physical therapy for 6 months myself, I'm still not trained in it, but at least I can be very empathetic and compassionate for people going through it. Maybe someday down the road, I'll get my certification for that. But where does somebody look to say, hey, is this person specifically trained and certified in pelvic floor therapy?
Yeah, there's a couple of different ways to go about it. I'm so grateful for the internet and access for people who may not know this exists. I've had people who travel, to be able to find this type of therapy. But I was trained with Herman and Wallace. It's a continuing education course company that really specializes in the pelvic floor. And they have a website, hermanwallace.com, that you can go to. And there's a specialized link that says find a practitioner. And they can look in this directory anywhere in the United States. You can type in your zip code. So if you're looking to help someone else, a loved one that's having issues somewhere else in the United States, you can help find a practitioner for them. Again, sometimes all those specialty things don't work for you, and you just have to use Google to say pelvic floor physical therapy, and then your zone, your area, Colorado Springs, wherever you reside. And I think it's really helpful to find reviews on certain practitioners just to hear other patients' experience. It's just like you said before, not one size fits all. Not every therapist is going to fit every patient, but I think getting an idea for what are the specifics that you need in your life. And if you find reviews that are consistently hitting on those issues, empathetic, good listener, soft, gentle pressure, or you might be the opposite. You might love, deep pressure and fascial release. And so kind of understanding, if you have a great awareness of your body, you can search real specifically. If you just need to get started, hopefully just getting your foot in the door and making an inquiry into a pelvic floor therapist in your area will help find your way down the line. And so for some people, it's not that first practitioner that they meet. For some, like serendipitously, we just clicked and it was wonderful getting to work with so many patients. But I really hope I try to be in my practice real open to hear what patients' needs are and to not be so sensitive if I'm not the right fit for them. I really want to help guide them to the place they need to be. So searching specifically pelvic floor, especially Herman and Wallace, I'm a big advocate and fan of. We talked a little bit about visceral manipulation, and so the same thing fits for that. I trained with the Barral Institute, Barral. And so there is the same function on their website to find a practitioner. Yeah. And again, there are so many people out there that have specialty with different companies, with different continuing education. So as much as the training is so important, finding the right person that you click with and fit with and that you feel comfortable sharing with, I think is also really important.
That is excellent advice. And just so that the listeners know, Herman and Wallace are not two men. They're actually two women practitioners, and those are their last names. Because I'm like, really? We got two men heading this up? Come on, people. We need more women practitioners and professionals and while pelvic floor dysfunction happens in men, would you say that the majority, though, is with women?
It is. And I think it's important as you're first accessing something, if you're feeling nervous or having that feeling of, I just don't feel comfortable, finding those pieces. I've worked with a few male patients, and I don't specialize in men's pelvic floor. There's additional training for that. But I am able to do some external work on the pelvis, which has really helped. And so I think understanding too, there's lots of different ways to access dysfunction. And sometimes if you're not feeling comfortable, having a therapist work on your hips and low back and your core can sometimes be your entry point into feeling a little bit of relief in terms of, like you were describing, that excessive tension in the pelvic floor. And so I have so many people that are they can't get over that hurdle initially of that internal examination. So I always tell people, try not to let that stop you if you're interested in helping, pelvic function. Just ask them what options there are for treating externally first, if that is a barrier for you. Almost inevitably, I've had so many people feel relief with that external work that they say, oh, I'm so relieved. This is so much better. What else can we do? And they suddenly become comfortable to other options later down the line once they gain your trust.
Yes, exactly. It's building that relationship and that trust with your provider. And one thing that I know both you and Megan and all my other team, it was always, here's my touch. And it was an introduction of your touch, maybe like on the outside of my thigh. And we're always draped and covered. It's not like the German way of mammogram is you strip down and you walk across the room and you get your mammogram. And this is very different, where there's plenty of draping and comfort, and there's gloves, and there's, the special slippery stuff lube that to make people more comfortable. And I remember asking one of my therapists, I said, could you use more of that, please? Or do I need to just bring my own? I'm totally willing to bring my own. And the answer was, no, we will use more. And, learning that even just that little difference, and learning to advocate for ourselves and speak up of what does my body at 50 something need for that time, to make it a positive engagement and interaction. And I would even, after my therapy visits, I would go out and I would walk the parking lot and walk around the block sometimes, just dictating what I learned and processed, and I'll share that at a later time. But it was really, really interesting for sure.
Yeah, I think something that helped me was really breaking it down to not be something, I guess, so personal in a way. In that area, we really protect that space, and that's very appropriate. And then when someone's trying to help, as a practitioner who's trying to restore function, I would always pull out my pelvic model and really help break down the anatomy for people so that they understood it looks like muscle in other areas of your body. And this is what we're trying to restore. So I don't want you to feel like, we're entering this personal space in a violation sort of way. Here is what we're going to work on. And just having that visualization and that explanation, I think, broke down some of that uncomfortableness for patients, at least getting started. And then I just had so much amazing connection with people when they could feel, if I would palpate a certain muscle internally, and they say, oh my gosh, that's my pain, or, oh, that refers exactly like what I've been feeling. And this identification of, oh my gosh, there is a reason why I've been hurting, why I haven't been able to remain continent, why I'm having pain during penetration, and this relief of someone finally located what I've been trying to communicate broke down so many barriers to have it be something that be accessible in a medical way, that just helped people be able to address it. And again, like you use that word so much, not feel shameful, not feel embarrassed of this area, but to understand, I wouldn't feel embarrassed telling a doctor, I sprained my ankle, can I get some help? So why do we have to feel embarrassed about getting some help for this area as well?
Yeah. Oh, I love how you explain things, and just to truly normalize the conversations. And that was one of my greatest inspirations for starting Community Bloom, because I want women to be able to get this information. And I'm coming to a professional that practices pelvic floor physical therapy, and, hearing from you directly with your experience and who they can go to. So I think that is so awesome. And I'm so glad we had this part of the conversation. I'm pausing the conversation here, and we'll follow up with one on visceral manipulation specifically next time. But I hope your takeaway is that both men and women need pelvic floor physical therapy oftentimes in their lives. We can advocate for ourselves and better connect with our bodies, and how to communicate that with our providers. And above all, I really hope we all learn to release the shame and have these conversations so that we can live our best lives, no matter the age or stage that we're in. And Stacy Gresham, thanks, and until next time. Hey Hey, thanks so much for listening. I appreciate it. Please subscribe and share this with a friend, another woman who is 40 and better who needs some encouragement today. Thanks so much. This is Hillary Baggett with Hill Talks Midlife Podcast. We are so grateful that you listen, and we hope that you know you are not alone. And as always, we hope you feel the love. Music brought to you by Belmont Club, March of the Dragonflies. Until next time.